Welcome everybody to our guests from Israel who are going to give us an update on the coronavirus, on what the current situation is in Israel. I'd like to introduce Eilat. Can you please introduce yourself?
Hi everybody, I am Professor Eilat Shinar and I am a Deputy Director to MDA Director General and the Director of the Magen David Adom Blood Services in Israel.
Eilat, thanks for giving us your time. I'd like to ask you a couple of questions. I believe you're taking plasma from recovering COVID-19 patients and infusing the plasma into very ill patients. Is this helping them recover? And does this stop them from repeat occurrence of the virus?
Yeah, we did start a week ago to collect plasma from convalescent people from COVID-19, coronavirus disease. And we are supplying it to the first patients in Israel. So far, we've treated 7 patients in 7 different hospitals who are, some of them very severely ill, some of them moderate to severely ill, to try and help them fight the virus. The idea of taking plasma from recovered people is that in the plasma of those who recovered from the disease, there are proteins that are called antibodies. And these antibodies are were built in contrast to the virus. The assumption is that we take this plasma with the antibodies and we transfuse it into patients who are very sick, helping their immune system to fight the virus.
Have you had positive results from this?
We are happy to carefully say that the first patient in Israel that got the plasma, and this was last Thursday, so about a few days ago, he got 2 units and his doctors report a very nice improvement. The nice improvement is that he can have his own blood pressure without they having to add any kind of medication. His respiration is better. So we are all hoping that he'll be better due to this treatment. All the others got the plasma 2 or 3 days ago. So we are all hoping to see that, I hope that at least some of them will recover. I just need to say that in some of the treatment, we give it to patients who are very, very sick, and it may be too late in the disease. But we are very positive and we do hope that it will help them.
Are recovering patients willing to donate the plasma?
Absolutely, absolutely. The people whom we call, I would say over 90% say that they are absolutely going to come and donate plasma. And also today, which is, you know, a Passover, Chol HaMoed, we had 8 patients, I should call them donors. They're not patients anymore. Yesterday, Thursday, we have many patients, many donors. And next week, we are putting a second shift because the plasma is collected in an hour. So it takes more time than just a regular blood donation. The donors are connected to a machine that separates the plasma and separate it to a bag and gives the donor all the other component of the blood back. So we hope to have more donors, more recovered donors starting next week.
Are you managing to collect enough blood during the current situation?
Yes, fortunately, we actually prepared ourselves in advance. So in when first Corona started to be noticed in Israel, we collected much more blood than regularly, and we have built a very good inventory of blood in Israel. So far, we can provide all the blood and blood component needed to all the hospitals, and we have enough. So we have enough. Yes, we prepared ourselves.
That's good. Tell me, do you know of any alternate medical treatment like herbal medicine that can help people with COVID-19?
I don't know. I think that we don't know enough about this virus, and we don't know about enough about other medication. When you look at what people are giving to the COVID patients, you see that it's a mix of different medication, that some of them were given in China, some of them were given elsewhere in the world. So a lot is trial and error, unfortunately. We don't know enough about this virus and about its behavior. So I would say that if we stick to medication that proved in some cases that they are good, and of course the plasma that contains the antibodies, this is like an old-fashioned treatment that was used years ago in other viruses. We hope that we can do it. And of course, we are all waiting for the immunization against the virus, but this will take many months, I think. So we have to stick to what we know and what we can use right now.
There's been some,
and of course, the most important thing is the prevention. So people have to obey, people have to stay home, people have to wear masks and gloves, and really minimize the contact, especially with the older group of patients that get infected very easy. And this, I think, can be a game changer.
There was some talk tonight from an infectious diseases specialist, Sharon Lewin, who you've met in Australia, about using some HIV medication or arthritic medication. Do you know anything about this?
Yes, it is done also here. The similarity is that all the medications that are used try first to disrupt the connection of the virus to the cells of the lung, of the respiratory system. Then not to let it go into the cells, and then not to let it make make more viruses in the cells themselves. So that
we seem to have lost Professor Shinar.
There are some similarities. It would be nice to have something that is really specific to the coronavirus, but the thing is that the pandemic is so severe that we hardly have time to develop other medication and test them and make sure that they are safe. So that's why the physicians who are treating the corona patient rely on using what is approved even to other viruses, hoping that it will work in this virus as well.
Eilat, the final question to you. Due to the current situation, is there any delay to the building of the new National Blood Centre?
Not really. And actually, after this conversation, I'm heading there. We make a lot of arrangements to continue the building. It's true that we don't do it in the same rate, but we're still working every day. And you know, we have cameras, so we can watch and see what they're doing. And it might have some delay, but the need is so great and so big that we hope to be there very quickly.
Well, let's hope the dedication will still be May 2021. And I thank you very much for giving us your time. Stay well. And we'll now go to Uri. Uri, would you like to introduce yourself?
Yes, hello. Bye, Professor Shinar. Thank you. Bye-bye. Hello, everybody. My name is Uri Shacham. I'm an assistant to the Director General of Magen David Adom, and I'm also the director for the Red Cross department in Magen David Adom, as Magen David Adom is the Israeli National Society, who is a member of the International Federation of the Red Cross. That was long, Glynis.
Thanks, Uri. Uri, tell me, how are the medics and paramedics and the National Dispatch call centre takers managing with such long hours?
Well, I think there are two factors that that allows us to handle this situation for a long period of time. First of all, is the amount of staff and volunteers that we have. Magen David Adom has more than 25,000 volunteers, and once a disaster strikes or a crisis occurs, then everybody are they want to do more. They are willing to continue their activities longer than usual times. They are very devoted, and this is the second factor. People feel that they are doing something which is important to the population, they feel that they provide the accurate information, and that what they do is important. Besides this, we are also using our teenage volunteers as information providers and call takers for non-emergencies. That means that if you have an inquiry regarding the coronavirus, then Magen David Adom volunteer who is can be 17 years old or 18 years old will answer you. Of course, we supervise their activities and we make sure that they follow the regulation. Nevertheless, the amount of the people and their devotion and dedication is something that allows us to handle this.
How many extra volunteers have you called up in the last few weeks?
So first of all, we have around 1,000 medical students that are out of university since the semester was delayed or at least stopped for the meanwhile. And we train those students, and they are assisting us with swab samples collection throughout the houses and the drive-thrus. More than this, we have staff that are coming from the IDF and also volunteer for Magen David Adom. And we have many more volunteers, usual citizens that come and say, I want to help, I want to do something for Magen David Adom, and as a result for my country. To my estimation, we enlarge the number of volunteers something between 15 to 20%. And I think that this is the Israeli spirit of volunteering during times of crisis.
That's good. With the drive-through stations, how many tests are you doing approximately a day?
Well, the amount of tests that Magen David Adom is collecting, we're not performing the tests themselves. We are collecting the samples. The tests are done in the laboratories. It really depends on how much samples the laboratories can collect. Magen David Adom is able to perform up to 20,000 tests per day. Nevertheless, since there is a shortage of reagents, this is the material that is used to perform tests. We are only taking 6,000 currently.
Are you going to be getting more test kits?
So we know that Israel now is going to use a new material or a different material that is produced in Israel itself. It's something that the Israeli government has been working very hard for the last 2 or 3 weeks. And this is a strategic plan that allows Israel not to rely on sources that are outside of Israel. And we believe that within 5 to 6 days we'll be able to at least triple the amount of tests taken. That is to go to 20 or even 30,000 tests per day. Anyway, Magen David Adom is prepared for this. We only need. Yes, please.
Once the test is taken from the individual, how long till they get their results?
Usually it takes between 48 to 72 hours. The result is being the sample is being tested, and then the result is sent to the patient through his medical insurance, his mandatory medical insurance in
Israel. Uri, the situation in Judea and Samaria, are they abiding by the directives of the government? And is the situation there under control?
Well, the Israeli government has decided to treat Judea and Samaria exactly as it treats the population in Israel. because everybody understands that if there will be a corona outbreak within the Palestinian Authority, the consequences can be disastrous as to create humanitarian crisis over there. So in this term, Israel is providing tests for the Palestinian Authority. What Magen David Adom is involved in is opening a drive-through in eastern neighborhoods of Jerusalem to allow Eastern Jerusalem's residents to come and to go or undergo tests. As far as we know, people both in Israel and in Judea and Samaria are abiding the regulations. Of course, you can see, as in all populations, people that or minority of people who doesn't obey, but they are treated by the authorities.
All right, Uri, just stay there. I'm just going to switch to Yoni. So Yoni, would you like to introduce yourself, please?
Hello, my name is Yoni Yogodovsky. I'm the Director of the International Relations and Fundraising Department in Magen David Adom, and very happy to speak with you.
Thanks, Yoni. I've been reading in a lot of reports that the situation in Jerusalem is getting slightly out of control. What is the situation there, and how are the very religious communities responding to the government directives?
Well, the government has implemented a variety of steps in order to isolate either cities or small communities and even neighborhoods where there are high numbers of people who are already tested and positive to the virus, and their, let's say, the amount of patients that are being added on a daily basis or on a weekly basis is much higher than in any other place in Israel. And that includes some of the ultra-Orthodox neighborhoods in Jerusalem that since yesterday noon were kept in a more tighter closure. So it's not easy for the people who live in these neighborhoods to leave the neighborhoods or to travel between one neighborhood to the other. It's part of the steps that the government is taking to make sure that there is physical, we call it isolation between different groups in the Israeli society. And it's not an easy decision taken. It has a lot of repercussions on it, but it seems that it might be one of the steps that the government is taking in order to control the outbreak and begin to reduce the numbers, as we see it now slowly but constantly over the last few days in the Israeli general public.
Are the people that are going out in public wearing masks as they have been asked?
Yes, the Israelis, as Uri said and as Eilat said, are obedient. There's every now and then a group of people or individuals that are not paying attention and are being taken care of, but the Israeli public is responsive. We practically live in a prolonged Shabbat. I can tell you that Passover looked to me, as I live in Jerusalem, like another Yom Kippur. There were hardly any cars moving in the streets, and Passover itself, and then at the night of the Seder, it's one of the peak of travel of commute in Israel, because everybody's driving to do the Seder with their families, and there are traffic jams. People are taking care. People understood weeks ago how severe this situation is and how smart is to obey to the directives of the government, the Ministry of Health, etc.
Yoni, Magen David Adom has really been on the front line now for many weeks. What's the greatest need? What's the shortage? What medical supplies do you need urgently?
Well, we should always remember that in addition to this current fight with the coronavirus and the samples that we take and the transportation of patients who has corona from home to hospitals or from hospitals to hotels, etc., we continue on providing the regular medical assistance to the general public. Fortunately, we see less car accidents because of less of traffic, but still we do see people who suffer from a variety of medical problems, and we continue to provide the service, and we need the assistance to help us use and activate this system with the medical equipment, medical supplies, ambulances, of course, etc. I have to tell you that we were able to do what we are doing now in a crisis situation because of the help and the assistance and the generosity of donors that led us to this point that we are fully equipped. We were ready to deal with it. We had the trained volunteers and employees. We had the ambulances. We had most of the equipment, so we could respond in the way that we are responding. Magen David Adom gave the Israeli medical system the breathing aspects in order to get organized and respond to this chaotic situation, and we continue on doing it. And we are able to do it because we were ready, because of years and years of giving that was brought to us, and we needed to continue because we are at the middle of the struggle. Nobody tells us that it will not come again. There won't be additional peaks. It will not return in our winter in about, 6 or 7 months or so. So Magen David Adom has to be ready, whether it's in our ambulance system and needless to say, in the blood services. There's a lot that depends on our abilities to support the Israeli population and the hospitals in Israel.
Thanks, Yoni. Uri, are you getting any additional support from the government at the moment?
Well, currently, the government provide us with the protective equipment for the sample collectors, and basically the government pays for services that it asks Magen David Adom to do. But what the government doesn't do, it doesn't provide us with funds for future preparedness. I agree with what Yoni said. We should look ahead. The corona is here, and it will remain here for the next months, or even for the next year. We are thinking about how can we better prepare for additional outbreak. An outbreak of a virus that nobody knows what's his name, or for a conflict that might develop once the corona is over. And Yoni said very accurately, one day the corona will be either a reality that we are going to live with, or will be over us. But then we'll still have the EMS services. We'll still have to provide blood for the entire nation, and these services might be enhanced because of the corona. Nobody thought that we would be taking plasma, as Professor Shinar mentioned, from coronavirus patients. But now we have to make sure that the new blood center has the capabilities of doing this for another outbreak, that the ambulances will be equipped to transfer patients that had corona and now are suffering from something else. This is the phase that we are now strategic planning for the next few years.
Okay, so either Yoni or Uri, you can answer. So as if you were to say to a Friends Society or to the donor, what's your greatest need now? What do you need to purchase urgently? What can they help supply you at this moment?
Well, as I mentioned, we need the continuation flow of medical medications, medical components, medical supplies. variety of machineries that we are daily using and expanding the use. And we will know that we will need to do it furthermore, especially if the numbers of severe patients will grow in Israel. And now it's relatively stable, but we don't know whether things will get worse. We see it in other countries. We learn from other countries, and we have to be ready to any scenario because we are the only organization in Israel. Any help for medical supplies, medical equipment, ambulances, equipment for the blood services, as test kits, as blood bags, etc., is highly needed, especially now. It's needed throughout the year, but it's even more needed now while we are speaking.
Are you able to purchase these goods easily?
Well, it's not a secret. It's a world struggle to reach and purchase medical supplies and medical equipment. We have our own suppliers and we are in constant communication with them. Sometimes it's not so easy. Knowing that we have good working relationships with them sometimes help, or long-term relationships with them. And this is why we need to be on our toes and try and reach almost every opportunity now to purchase, because we will need the equipment that we purchase today within a few weeks or within a few months. So we must have full inventory of supplies of any aspect in order to be able to continue and provide the services that we are doing today, tomorrow, in a month, in 6 months, in a year or more.
Well, we've got our upcoming appeal coming in June, and we'll be reaching out to all our donors to help support you with funds to buy urgently needed medical supplies. Thank you both for your time. We will be making an urgent appeal as quick as we can for funds to help you. And we really thank you for your time and hope that you all keep safe.
Thank you very much.
Add one thing?
Yeah.
On behalf of the people in Israel, on behalf of us in Magen David Adom, all of us, the volunteers and the employees and our patients, we thank you all for doing an amazing job and assisting us for so long. You are our partners, you are our faraway volunteers. Without your generosity, we would be different. Things would be completely different here in Israel. Thank you so much. And Chag Sameach.
Chag Sameach. Thank you.
Pesach Sameach.
Thank you.
Bye-bye.